For the glenohumeral joint mobilizations, the arm is kept at the side. It is abducted for about 30 to 40 degrees at the arm, and then the first movement is posterior to anterior glide. The posterior to anterior glide movement is given to reduce the pain associated with extension and external rotation, and to increase the range of motion if at all restricted for extension and for external rotation. The arm is kept in the abducted position. The therapist is just sitting down. The scapula is supported on the pillow. Therapist is placing the pulp of the thumb at the upper posterior aspect of the arm. The other thumb is reinforcing it, and then the glide is applied postero-anteriorly by the butterfly movement of the therapist. Grade 1, 2, 3, 4. So, this is the movement, butterfly movement. No movement to be given just with the pulp of the thumbs, because that may cause irritation. So, movement should be from the shoulder region. This is the posterior to anterior glide. For anterior to posterior glide, the arm is abducted for about 40 degrees. The heel of the palm is kept anterior to the humeral head, and then the glide is applied posteriorly. Grade 1, 2, 3, 4. The anterior to posterior glide is useful to increase the range of motion of the flexion and of the internal rotation, or to decrease the pain associated with flexion and with internal rotation. Inferior glide. For the inferior glide, the arm is abducted, the elbow is flexed to 90 degrees, the therapist is holding distal part of the forearm, therapist is placing the other hand at the ventral aspect of the upper forearm, arm is abducted for about 40 degrees, therapist is in work standing position, and then gives inferior glide. Grade 1, 2, 3, 4. Inferior glide is given in order to increase the abduction range of motion or to decrease the pain associated with abduction at the glenohumeral joint. The other technique, other method of giving the inferior glide is the therapist is placing the pulp of the thumb at the greater tubercle, reinforcement is done, and then the glide is applied along the long axis of the humerus. Grade 1, 2, 3, 4. For the inferior glide, the therapist is palpating for the greater tubercle of the humerus, placing the pulp of the thumb out there, reinforcement is done, the glide is applied along the long axis of the humerus. Grade 1, 2, 3, 4. Lateral glide to the glenohumeral joint is given in order to alleviate the pain if it is very much at the glenohumeral joint. So, for that the therapist is placing both the hands, this is called as close coupled hold, at inferior part of the axilla. The lateral aspect of the elbow is kept in contact with the pelvis, and then the therapist is applying the pressure from the medial aspect lateral. Grade 1, 2, 3, 4. Grade 1, 2, 3, 4. Lateral glide.